love and respect for the entire family. The Bush family have long been good friends of Houston Methodist and strong supporters of our mission of leading medicine. President Bush's and Barbara Bush's physicians, Dr. Amy Minders and Dr. Clint Dorr, are here with us today. Dr. Minders will give a brief update on their conditions, and then she will take questions. Thank you.
Good morning. Today is a great day, actually. Mrs. Bush has been discharged from the hospital, and President Bush will be moved from the ICU to a regular floor today. So both are doing really, really well. Questions? Sure. President Bush had a pneumonia, a bacterial pneumonia, and is making daily improvements. Mrs. Bush had a viral bronchitis and was really just kind of running herself ragged, trying to be up here with him. And so more for precaution than anything, we kept her for a few days to try to get her back in better shape. And now she's back to her normal self. He is sitting up watching TV and is waiting anxiously for his favorite oyster stew for lunch. He's on minimal oxygen, joking and laughing with the nurses and doctors.
He still has a fair amount of coughing. We are addressing that with various breathing treatments to help his bronchial tubes be a little less twitchy, for lack of a better term. Not nearly the amount of phlegm he had earlier in the hospitalization. We've been able to clear out his airways, and that has certainly helped his breathing, helped his oxygen, and helped that coughing. We'll still be working on that as he transitions out of the intensive care unit today on the floor. So he'll need a fairly aggressive combination of breathing medications. We'll finish off a full course of antibiotics as well. I would anticipate at the rate of improvement at this point, and Dr. Minders and I obviously were here along with the full Methodist team back in 2012, which, as you recall, folks, was quite a long stint in the hospital. But if everything continues at the pace of improvement that we're currently enjoying, I would imagine, let's see, today's Monday, continued improvement throughout the course of the week. A Friday discharge might be a little bit optimistic, but Friday or over the weekend, literally it's a bit of a moving target. It is fluid on him in terms of leftover residual inflammation in the bronchial tubes, in his lungs, and then that certainly influences his oxygen, his coughing. Can we essentially get him improved to an extent that then we can manage things with a home regimen of breathing medications, etc.? Everything is actually proceeding nicely. He had the roughly 48-hour need for that ventilatory support with the obviously tube down the throat, hooked up to a ventilator. And once we were able to clear out his airways, we identified the bacteria, caught back up on the inflammation and the congestion there. Then essentially we turned down the ventilator to a low setting, about as close to breathing on your own as you can with a tube still in your throat, and looking at his numbers, looking at his oxygen, looking at his, what we call the mechanics of breathing, sort of the strength of breathing. And if all that looks well, looks encouraging, then the working with the ICU team here, we were able to remove the tube, obviously continue some oxygen through the nose, but he has done very well in that regard. We did not see a rebound of difficulty breathing, of tiring out. x-rays continue to improve, so no obvious reaccumulation of material in his airways that would then again put him behind the 8 ball.
Can you please characterize how significant of an outcome this is? I mean, we initially hear of someone of his age, underlying health issues, and we hear intubated and in intensive care, and now we're talking about a being released from ICU.
Right.
I mean, that's pretty significant.
Sure. You know, absolutely, I agree. You know, anytime you hear of a 92-year-old gentleman with a pneumonia requiring intubation, it's a very serious situation. And, you know, you never really know how the patients are going to do at that point. The fact that he is doing so well just 5 days after the event that caused him to need to be intubated, I think is a real testament to the pulmonary team that's been taking care of him, Dr. Dorr, as well as, you know, our nurses and ICU staff, but also to him. I mean, he's a really strong person. So he's not your average 92-year-old. Well, unfortunately, with you know, the patients that most frequently have these kind of complications are older patients. So we're both very versed in taking care of, you know, 80-year-olds and 90-year-olds that are facing pneumonia. You know, really, you just have to, like you said, take extra precautions. You have to adjust medications accordingly, and just take into consideration that their baseline strength is not the same as somebody who's 40 or 50. Like, you're trying to get them off the ventilator and things like that. So, like Dr. Dorr was mentioning, you know, they were looking at the mechanic to make sure he was strong enough to be off the ventilator. And as he also mentioned, he's done quite well. He hasn't really been talking about it much. I mean, he, you know, he watched the TV, but he didn't, and was making, you know, just, oh, look who's there, and commented on seeing his son there and things like that. But he hasn't made any, you know, political statements or anything like that.
No insight into the opinion or thought process that he shared with us, anyway.
No.
Yes, ma'am. Well, I just left the bedside shortly before our conference here, and she was, I'd gone up to the floor where she has been. She was already gone out of her room. She was down in intensive care, sitting right next to him, watching TV, interacting with him. Dr. Miners?
Yeah, they truly do have just such amazing love for each other, and that really came across here. Like I said, part of why she ended up, I think, in the hospital was because even though she was ill, she was trying to be by his bedside all the time and wasn't able to get the care she needed. So when we put her in the hospital has been really great about, you know, giving her breathing treatments down there and, you know, trying to make sure that they're together. But other than sleeping in separate rooms, they pretty much she's been sitting at his bedside most of the time, getting most of her medications. Her nurses are bringing it down to her and things like that.
They're essentially therapy for each other.
Yes, they really are.
They help in our compliance in terms of when one of them doesn't want to take a breathing treatment, the other says, done that.
Yeah.
You know, I mean, it helps our cause.
Moving forward, how that that comes into play? Has she left the hospital already this morning?
I believe if she hasn't yet, she's going to shortly.
Okay, and then
She actually has some things to take care of at home and said she's coming back in the afternoon with him as a visitor, not as a patient.
In addition to the invitation, did you do a lump stuff?
We did, and for just to define the terms, so the same fiber optic technology that is used for colonoscopies and such, we have similar technology for the lung. It's obviously a lot smaller, where we can go down, take a look around the bronchial tree, suction and remove thick secretions that, say, for example, a 90-year-old is having difficulty bringing up and expectorating or getting rid of, which then unfortunately, in a way, plugs up the bronchial tubes and contributes to even further difficulty breathing. So we did perform a bronchoscopy and were successfully cleared that material out of the president's airway. Down in the ICU, even when he still had the breathing tube in, he gave us the thumbs up, which is again a testament to his intestinal fortitude, because I sure would want to be knocked out if I've got a tube down my throat. So remarkably great attitude.
He asked me today when he gets to go home, and I was telling him he gets to get out of the ICU today, and he said, "Oh, I don't think I need to be here. Can I just go home?" So and then we talked about possible discharge date, which what Dr. Dorsett was about what I told them too. And he said, "Okay, well," but he's excited to get home, and he's feeling well and feels well enough that he actually doesn't feel like he still needs to be in the hospital.
I believe the statement was prior to the intensive care unit stay. I think Mrs. commented to me, "You need to get us out of here and tuned up because we're going to host that Super Bowl."
That's right. That's right. Like Dr. Dorsett, they really truly are therapy for each other. When she's not there, he's looking for her. When she can't be down there, she's, hurry up, let's get this antibiotic done, let's go, because she wants to go down there. So, and then additionally, as Dr. Dorr mentioned, they kind of get after each other. If somebody's being a non-compliant patient, then the other one said, no, you need to do that, you need to do that. So they just take care of each other, and it's very obvious how much they mean to each other. No, sir.
So the person still has pneumonia, and that's correct, you say he still,
He's recovering from pneumonia.
and then Mrs. Bush is still has to be recovering from pneumonia.
Correct.
You mentioned the Super Bowl, and I know that was something that was sort of talked about. No one has a crystal ball, but if we continue on this trajectory, is it feasible that they would be able to personally go to the Super Bowl?
Feasible. Would the doctors really want that? I don't know, but he and she can veto us
Right.
at any moment. So
Yeah.
to a certain extent, no. At the rate of improvement, although I think both will still be recovering from this over the next week to 2 weeks. If any couple in their 90s could rally to the extent that we feel comfortable medically, they could do that. But we'll have to, that really will be a bit of a moving target. Yeah.
I would say he's a 92-year-old. I mean, as we all know, he suffers from a form of Parkinson's that's affected his lower body, requiring him to use a motorized wheelchair. So, but as far as, that's his main health issue, and it is fairly debilitating for him, and has, pneumonia in an older patient is going to knock him down a little bit more than it would in somebody in their 50s. I would say he's generally in decent health, but he is 92. And as we mentioned before, though, if there's a 92-year-old that can overcome, it's him. We've seen that through his whole life. So.
In general, obviously this age group doesn't have as much reserve as a decade ago, let alone 40, 50 years ago. It doesn't take much from a respiratory standpoint, to get into trouble. We try to remain very diligent in the outpatient arena between his primary doctors, myself, and my group, etc., in monitoring that, being proactive with a cocktail of breathing medications at home, etc., to maintain some of that airway clearance. I certainly coordinate. He has a wonderful team of support, not only the Secret Service detail, but the rest of the team at home that helps him from a medical standpoint. And so I try to coordinate my efforts with that.
I can say it really is a testament to both his aide and his medical team at home, as well as Dr. Dorr and his outpatient physicians, about how well he has done and able to stay out of the hospital. They really do a great job being able to take care of any issues that come up at home, and just occasionally, things get to where we need to have a little more prevention, but they've really done a great job.
And obviously on the inpatient basis too, I've got to reiterate, sort of like the old adage, it takes a village to raise a child. It takes a village both on the inpatient and the outpatient setting of keeping our older patients tuned up, as they say. So real testament to the intensive care unit team here, the respiratory therapists, physical therapists, nutrition, pharmacy, as well as all the various docs involved. So.
Can you tell me if the Parkinson's affected his illness in any way, and also how that affected his treatment?
Well, as we mentioned before, for his Parkinson's isn't the typical Parkinson's that we think of. He affects more of his lower body. It probably does have some to do with his a little bit core strength, as far as how strong his cough can be and things like that. But as far as, a lot of Parkinson's patients with more advanced typical Parkinson's will have trouble swallowing, things like that, and he doesn't suffer from any of that. So while I'm sure it played a small part, more just in his core muscles and things like that, I don't think it was as big of an issue as it would be for somebody who had a typical Parkinson's and we were dealing, with something like an aspiration pneumonia, which was not the case here.
Can you tell me their overall reaction, because they just received an outpouring of support from just everyone across the world? What was their reaction?
They're so humble. They truly are the most humble people, wouldn't you agree?
Absolutely.
And today, when I told them that, any words of advice, I'm going to go talk to the press, and he said, about what? And I said, about you. And he said, people want to know about me? Like, he still doesn't not that he doesn't understand, he just doesn't feel like he doesn't understand how loved he is, and her too, and so there was actually a family from Conroe who made them this beautiful card, little kids, and drove it from Conroe and just delivered it to the hospital. They didn't try to, see them or anything. And it's hanging up in his room. Like, they're very grateful for the love that people show them, and just are extremely humble, and I think a little bit awed by how beloved they are.
They never give any outward sign in terms of their behavior, let alone their requests in terms of setting themselves on a pedestal. When President rolled in initially, and Mrs. was at the bedside when we were kind of getting things arranged when he first came in over the weekend. She was in. I had my son, my 7-year-old son, in tow. My wife was working and on call at a different facility, and she insisted on meeting him. I was like, well, he's in his German Shepherd T-shirt and a short pants and sandals. I probably not the entire appropriated tiger here. Nope, want to be. So, yes, ma'am.
Yeah.
So just they're so very caring and appreciative. She commented just again right before our conference here about how truly impressed and appreciative of the care that they've received and the team that has been with their care, involved with their care. So.
Are there any last questions? Thank you all for coming.